Good luck, everyone.
Okay. And I'm on mute officially now.
Okay. Hello, everyone. This is Larissa Kaufman with the National Alliance for Safe Housing, and we are so excited to be able to present this special topic today. I want to briefly go over a couple of logistics that are important. We have a couple of you still joining. We are recording the session. We will be providing the PowerPoint slides, the recording, as well as other resources that we mentioned today, and may also note in the chat. So you all should be receiving those either later this week or early next week. If you can take a minute, I just posted this in the chat, to introduce yourselves, let us know which organization or agency you're with, and where you're located. That would be fantastic. So as a very quick introduction, because my fellow presenters will be introducing themselves and their respective organizations further into the presentation, I am just really, really privileged to have colleagues around the country presenting with me today. Christina Cortez and Bettina Robinson from LAHSA, the Los Angeles Homeless Service Authority, Kate Walsh with the Shriver Center on Poverty Law, and my colleague at the National Alliance for Safe Housing, Carlo Ng. So before we get into what we're focusing on today, Jenny, next slide, please. I want to introduce the series and also talk a little bit about the Domestic Violence and Housing TA Consortium, also known as DVHTAC. DVHTAC is essentially a consortium that our goal is to improve policies, identify promising practices, and strengthen collaborations to enhance safe and supportive housing options for sexual and domestic violence survivors and their children. We have several technical assistance providers that are part of our group listed below and work really closely with our federal partners listed on this slide as well. And as a direct response to COVID, we immediately recognized that there were some very pressing issues and common themes that we were hearing about. And we wanted to create a mechanism, a weekly mechanism, to be able to share what we know, what we're learning, and provide a space for all of you to also connect with each other on special topics. And so that is what we're doing. We have a special topic series every Thursday, and for more information about upcoming topics, you can go to safehousingpartnerships.org or any of our respective websites, which we'll share the information for as well. Next slide, please. So before we talk about emergency transfers, we wanted to also sort of lay the foundation and provide an overview of homelessness and race, racial disparities and race equity issues generally, and also what we're seeing during COVID. So over 78% of people experiencing homelessness were people of color. Rates of American Indian and Alaskan Native homelessness were also disproportionately high, 3 to 8 times higher than their proportion of the general population. DV, IPV, and SV are common threads across genders and age ranges of people of color experiencing homelessness. Next slide. With the COVID pandemic, as all of you are probably aware, the racial disparities in terms of access and also who is directly being hit with health issues, and also the tragedy of death really is connected to the racial disparities that also connects to homeless and housing instability and other access issues. So as of April 28th, Black Americans are dying at 2.6 times the rate of whites, 26 deaths per 1,000 people. Many states are effectively erasing Native Americans from their data by classifying them as other. States tracking the demographic have found severely disparate rates of infection or disease, infection or death. Next slide, please. Research suggests that racial residential segregation is a fundamental cause of health disparities. Communities of color disproportionately live in neighborhoods that are further from grocery stores, medical facilities due to historical racial discrimination and redlining in housing policies. Many people of color live in federally assisted housing, including public housing and Section 8 programs that are often in segregated neighborhoods with less investments. Next slide, please. For survivors, and this is not on the slide, so you're just going to hear me talk about this a little bit. I want to share some data. Survivors often face discrimination by housing providers via evictions or removals from housing due to domestic violence, jeopardizing their safety and placing them at risk of becoming homeless. Survivors experience a myriad of barriers when seeking housing, including the lack of affordable housing, long wait lists or closed wait lists for some federally subsidized housing, and limited or no shelter. According to a 2017 national survey, we know obstacles to access are exacerbated by discrimination by housing providers because of the violence committed against survivors, their race, immigration status, and lack of English proficiency. From the same survey, we learned that while emergency transfers are required under federal law, the frequency of utilizing or accessing transfers is low. We've seen these issues further compounded by COVID-19, and that brings us here today. So presenters are going to be providing an overview of emergency transfer requirements. We're going to discuss common themes and barriers and promising practices and strategies. We want to hear from all of you with questions in the chat box. We want to hear more about what you all are seeing in your communities. We're going to do our best to answer them in the chat box, and we're also going to have time for a question and answer period of about 15 or maybe 20 minutes at the end of the presentation. And as I said before, we are going to provide a recording material links and other resources from the presentation to you all after we're done. So without further ado, I'm going to pass this over to my colleague, Carlo Ng with NASH.
Thanks so much, Larissa. Hi, everyone. My name is Carlo Ng. As Larissa mentioned, I'm with NASH. So NASH provides technical assistance, training, and support to advocates on housing and homelessness issues that impact domestic violence and sexual assault survivors. If you'd like technical assistance support, you can visit us on our website at www.nashta.org, or you can also feel free to send me or Larissa an email with any questions, and our email addresses, as well as the other presenters' contact information are at the end of the slides. Next slide, please. So I'm going to get us started and describe briefly what federal law says about emergency transfers for survivors. The Violence Against Women Act, or VAWA for short, is a federal law that provides housing protections for survivors of domestic violence, sexual violence, dating violence, and stalking who are applying for or living in federally assisted housing. VAWA does not apply to market rate rental units unless there's some kind of federal subsidy involved, like a voucher. The federal programs that are covered include, and this is not a complete list, it includes programs like public housing, Section 8 vouchers, project-based Section 8, emergency solutions grant, continuum of care, the low-income housing tax credit program, and multifamily units that are funded by USDA. VAWA applies to a survivor regardless of sex, gender identity, orientation, disability, or age, and that's important to remember because it gets confusing with the Violence Against Women Act being called the Violence Against Women Act. There are a number of protections that survivors have under VAWA. So for example, they have the right not to be denied admission, evicted, or have their assistance terminated because of the violence committed against them or a family member. They must receive a notice of housing rights under VAWA. They can self-certify using a HUD self-certification form. They have the right to strict confidentiality of their information related to their status as a survivor. They can request that a perpetrator be removed from their lease or a program, and they can also seek an emergency transfer to an assisted unit. If you want more information about VAWA's housing protections, because again, this is a very quick overview of VAWA's housing protections generally, the National Housing Law Project has a great Know Your Rights brochure, which we can share with you in the chat box. Next slide, please. Under VAWA, housing providers, including public housing agencies and continuums of care, they have to develop and implement emergency transfer policies. So these policies have to allow survivors to transfer to safe units if the survivor expressly requests for the transfer and they reasonably believe that there is a threat of imminent harm from further violence if they stay in their units. Really important is that whether or not a unit is considered safe is determined by the survivor. It is not determined by the housing provider. Two of the federal agencies, HUD and USDA, that are responsible for administering VAWA's housing programs have issued rules or guidance about emergency transfers for survivors. Unfortunately, the IRS, the Internal Revenue Service, which administers the low-income housing tax credit program, has stayed silent about VAWA and hasn't issued any kind of implementation rules or guidance. HUD has a model emergency transfer policy that's intended to serve as a starting point for housing providers to create a more robust emergency transfer policy. This model plan itself is rather skeletal, and it actually does not conform to a lot of the emergency transfer requirements that even HUD said should be part of an emergency transfer plan. And despite this, despite the fact that the model plan is supposed to serve as a starting point, what we found is that many housing providers are adopting the model plan wholesale, and they're not providing critical information that makes the policies actually operational for survivors. So for example, the model plan does not address what happens if the housing provider cannot provide a safe unit for a survivor immediately, how long a provider has to effectuate an emergency transfer after a request has been made, and what happens if the survivor wants to transfer across different kinds of housing programs so as to increase safe housing options. So what this has meant on the ground is that housing providers have largely had to figure out on their own how to make emergency transfers practically happen for survivors, while still conforming with the existing programmatic requirements under HUD and other agency rules. As you can imagine, this has led to a wide range in quality and coverage of VAWA emergency transfer policies, from the very minimal to the robust, where in the latter situation, some housing providers have used their flexibility to create policies that truly address the immediate needs of survivors, whose safety hinges on their ability to move with housing assistance quickly. Our presenters today will be describing examples of some of these more robust policies and best practices. Okay, and the presenters are also going to be talking about some of the issues that are related to transfers. So for example, there is quite a bit of cost that can be associated with emergency transfers. There's some flexibility, especially within the Continuum of Care program, to actually use COC funds to cover, flexible funds to cover some of these costs. So costs include costs to terminate a lease because of safety reasons, moving costs, costs for a new security deposit for a new unit that a survivor might want to transfer with. And so presenters today will also be talking about some of the policies and best practices they've been using to address some of these needs of survivors as well. So with that, I will turn it over to Kate.
Thank you, Carlo. So my name is Kate Walls. I'm the Vice President of Advocacy at the Shriver Center on Poverty Law, which is based in Chicago, Illinois. We're a national organization, and our mission is to advance racial and economic justice. And I've worked on the Violence Against Women Act with many of the panelists for the last decade. So if we could go to the next slide, please. So, sorry, next slide. So I'm going to talk about options in terms of transfers and other safety strategies in the public housing and housing choice voucher program during this difficult period in our nation's history. First, as a reminder, we do have a federal eviction moratorium in place that covers all of the programs that are subject to the Violence Against Women Act. And so there's a moratorium on evictions for non-payment from March 27th of this year to July 25th of this year. It does not protect against eviction for other types of lease violations, but the VAWA prohibition on evictions remain intact. And you should be making sure that housing providers understand that even without that moratorium explicitly stating that they are still barred from evicting a person due to an incident of domestic violence or sexual assault. There also may be a state or local eviction moratorium, and they may have different dates, earlier or later dates, or different terms or coverage, depending on your jurisdiction. In some cases, it is that you can't even file the eviction case. In other cases, you just can't execute the eviction. So what strategies are there now? Emergency transfers should still be available to survivors at this time. HUD has encouraged PHAs to still provide for access to survivors to emergency transfers. Lease bifurcation, or sometimes what we call family breakup, when you need to remove a perpetrator from the unit, also should remain intact and is especially critical now, given the increase in domestic violence that we are experiencing. And so this is where the victim would retain assistance and the perpetrator would be removed from the lease. The one thing that you have to consider, both as housing providers and advocates, is if there is a moratorium in place, such as the federal moratorium, and as well potentially a state or local moratorium, the perpetrator eviction may not be moving forward. So coordinate closely with the victim, ensure that what steps are taken to help them be safe are done so in a way that meet what is possible. If the jurisdiction is not actually moving forward with evictions, you may have to consider other options like temporary housing options for the survivor until that eviction can move forward. There is as well on April 10th of 2020, HUD issued a waiver notice, HUD waiver PIH notice 2020-05. In effect, it gave housing authorities immediate flexibility on a range of issues as it relates to their public housing and housing choice voucher programs. And one opportunity would be to encourage local public housing authority to use that waiver authority to immediately amend their admission policy and to add, if they don't have it already, an admission preference for victims of domestic violence and sexual assault. If they currently have an admission preference, they can use that now without extending that waiver authority. And when I say immediate, what I mean by that is that they would not have to submit this out for public comment and go to their board. They could do this now and then subsequently make those amendments and take those procedural steps. You should also think through, again, with the consideration that evictions may not be moving forward, that may need to happen in terms of perpetrators, is if you could seek a lock change. There may be laws at the local or state level that would support the survivor having a legal right to a lock change, or a PHA or property owner could preemptively consent to the lock change. You could use potentially COC funding to cover the costs of those lock changes as well. HUD has also encouraged housing authorities to continue to process voucher holders for what's called ports. What this means is when you have a housing choice voucher in one jurisdiction, but you elect to move to another jurisdiction and to use your voucher there. And this is a particularly important feature for victims of domestic violence and sexual assault, that they could move out of the immediate jurisdiction. And so continuing to work with PHAs to accomplish that goal is important. And you could also ask that the voucher, if both the perpetrator and the victim are on the voucher, you could ask that the perpetrator be removed from the voucher and then the victim be allowed to port to another jurisdiction for safety purposes. Carlo noted some of the proof requirements under the Violence Against Women Act. It's really critical now to be flexible with proof requirements. As Carlo noted, you can accept a victim's verbal representation that they are covered by VAWA, and you can document that representation in the tenant file. If you are requiring written documentation, just a reminder that you cannot demand third-party a certification. You could just accept the HUD VAWA self-certification form. It's particularly critical now not to ask survivors to show third-party proof, as it may be much more difficult to get an order of protection or a police report or other third-party documentation as they're trying to shelter in place. Also a reminder how critical confidentiality is at this time. VAWA imposes strict confidentiality requirements, so you should not be sharing that status of a victim with others and not entering into any shared databases. Victims may be experiencing a drop in income. HUD has encouraged PHAs to move forward with what's called interim recertifications. So rather than do so annually, to note that the victim has a drop in income or the household has a drop in income, and to recertify them at that lower income level immediately. A reminder that the stimulus checks do not count towards income, nor does the bump in unemployment count towards income. As I said before, it's really critical to work with local domestic violence and sexual assault advocates at this time. and understand what systems are open and create real flexibility with those advocates and the victim, and really focus on what the victim needs and wants and thinks will be safe at this time. I'll just leave you with two examples of what advocates have been able to accomplish recently, even with respect, even during COVID-19. First, a legal aid attorney in California who had a client in public housing who was experiencing domestic violence was able to work with his local housing authority to get the victim an admissions preference due to the domestic violence, and she was recently offered a housing choice voucher. And then an advocate in Chicago who needed to help a client move from their site-based, project-based Section 8 housing was able to work with a number of project-based Section 8 owners in the area to find a handful of available units and allow the client to move in just yesterday. So working together and collaboratively in a victim-centered focus where their priorities and needs are the ultimate goal, I think will serve us all well, not just during this crisis, but for the long term. Thank you.
Thank you so much, Kate. This is Larissa with the National Alliance for Safe Housing, and I'm going to spend a couple of minutes talking about promising practices, strategies, and considerations for continuums of care. Next slide, please. So as Carla mentioned when she was providing the overview of VAWA, the final HUD rule, and emergency transfer requirements, many of the continuums of care and balance of states have adopted the model emergency transfer plan that HUD provided. And as Carlos said, that really is sort of an outline and foundational. And some COCs and balance of states have gone beyond that to ensure that their emergency transfer plan is operable for survivors. And what we have found, especially in the time of COVID, is that for plans, whether they are a plan that is modeled closely after that model HUD plan and or plans that are more extensive and elaborate further to ensure operability to streamline emergency transfers, that there are other additional considerations that COCs and BOSs, balance of states, can utilize and think about in responding quickly to the changes that we're all facing, especially the immediate needs of survivors who are concerned about their safety. So I just want to highlight a couple of things. I would recommend highly that COCs and BOSs review their current emergency transfer plan for operability and raise questions when the review is being done for yourselves around whether or not, if you were a survivor within a program funded through your COC, if the survivor would be able to access an emergency transfer within a short and immediate period of time. And if that's not possible, would that survivor be able to have a short-term immediate placement to as a sort of cushion in between while trying to find another placement for the survivor? If your answer is no, a couple of considerations for you in general and a couple of considerations for you connected to COVID. One of them is that because HUD requires a coordinated entry system, and around the country we have seen coordinated entry systems really consider what happens and what works for survivors who are homeless, who are also within the homeless and housing system. Something that we've seen for some COCs and balance of states is actually utilizing the coordinated entry system as a way to centralize transfers. So for example, if within your program, a survivor requests a transfer and is in need of a transfer, and there is no available safe unit or safe option for the survivor, there is a liaison at the COC, BOS, or within the coordinate entry system as it connects to the COC or balance of state, who can be contacted, who will assist in ensuring that the transfer happens, even if that transfer is outside of your program, which is also part of the emergency transfer requirements. That helps expedite the process because by centralizing the emergency transfers, there are many more options outside of your organization to help make that transfer happen. Something else that we are recommending is going beyond the Violence Against Women Act requirements in terms of program or program types that should also be included in the emergency transfer plan. So LAHSA, they're going to be presenting shortly after me, is going to talk a little bit more about this, but their emergency transfer plan is expansive. It covers their emergency shelter, bridge housing, and other short-term housing options. So for example, if a survivor is in bridge housing, that survivor can ask for an emergency transfer, and an emergency transfer can happen for that survivor, whether it's to another short-term housing option or another housing option that's available through the COC or balance of state. Something else, as we are all seeing, families, individuals and families who are utilizing motels or hotels, motel and hotel vouchering is happening in direct response to individuals or families that are either testing positive and or high risk. Something that you all can consider in your emergency transfer policies as a best practice is to include program participants or tenants who are in motels or hotels as part of your definition for program participant and tenant to ensure that they also have access to an emergency transfer. Carla mentioned this before early on, as did Kate. Ensure funding recipients have immediate access to funds for security deposits, first month's rent, furniture storage, a whole range of different things connected to moving. There's a lot of flexibility with COC funding for that, and also some flexibility with ESG funds that also fund rental assistance. Something else I want to flag is that, as Carla mentioned in her overview, housing providers do not have to request documentation. So they do not have to request documentation. However, housing providers often do request documentation, and survivors can choose which form of documentation they want to provide, including the VAWA self-certification form. That said, one recommendation that we have that's also being adopted by some COCs in the time of COVID is that there's no documentation requirement. We are seeing that it is very challenging, especially if the survivor chooses to not use a self-certification form and may choose to use another form of verification. So for example, a protection order, that it's really challenging right now, especially with courts being shut down around the country, having access to some of those documents. That being said, a VAWA self-certification form still applies, but our recommendation is to also consider, because it is in accordance with the law, just waiving documentation completely and not requiring documentation, so that can further expedite transfers. Last but not least, release of information. Survivors should be given the option, and this should be part of your emergency transfer policy, to sign a release, either actually sign the release and or give verbal release permission to their case manager or whomever is going through the information with them around emergency transfers, to make sure that that release of information is time limited, to ensure that that information, as it's going to be provided to a third party or not, a third party to actually expedite the transfer and make the transfer happen, is not shared widely and for a long period of time, because that jeopardizes the safety of survivors greatly. So we want to make sure that any information that is shared connected to transfers is limited. There are also other requirements around confidentiality, but I wanted to add the ROI specifically because from what I've seen, that's often not included in COC emergency transfer policies. So that's my quick overview of ideas, promising practices, strategies, and considerations for COCs and DOSs. And I'm going to go ahead and pass it over to my fantastic colleagues at LAHSA to talk about what they have been doing to address the safety of survivors during this time. Christina and Betty.
Thank you, Larissa, for that lovely introduction. Next slide, please. So like Larissa mentioned, Betty and I are from the Los Angeles Homeless Services Authority. My name is Christina Cortez. I'm the manager of Domestic Violence Systems Alignment.
Hello, everyone. I'm Betty Robinson, Domestic Violence System Coordinator with LAHSA.
And for those of you that don't know, LAHSA essentially is the pass-through agency for the Continuum of Care for the greater Los Angeles region. We apply and disperse local and federal funds, but we also play a role in the coordinated entry system. We essentially oversee the entire system, try to coordinate to ensure that there is equity and equality across the board, and we also reach out for new partners so that they can participate in the effort to house folks quickly and efficiently and in a fair manner. I will say before we get into the emergency transfer portion of our presentation, we're just going to give you a quick crash course on our community. That way you can see what we're working with and why we have a strong desire to centralize all of the transfers that are happening.
Okay, great. So a little bit of an overview of Los Angeles County. So I'm going to go ahead and break that down just so everyone is aware of the area that we're covering. So LA County is comprised of 88 cities. That totals about an estimated 10 million people in that population. And within that county, we actually have 4 continuums of care. Now, first we have Long Beach, Pasadena, Glendale, and then we have the greater Los Angeles Continuum of Care, which is the one that Christina mentioned that LAHSA provides oversight. Additionally, just to give you some idea on the numbers, as of our 2019 annual homeless count, our Los Angeles Continuum of Care was looking at 56,257 homeless neighbors that were accounted for in the 2019 count. Now, of those, we're looking for survivors. We have a breakdown, and I want to share that with you all. We have, for those who are fleeing domestic violence, 5% of those identified as fleeing domestic violence, 40% identified as experiencing domestic violence or intimate partner violence, and 16.3% identified as experiencing human trafficking in some capacity or point in their life. Now, additionally, we do want to share a very extensive resource that we have throughout the county. So LA County is broken down into 8 service planning areas, what we know as SPAs. In those SPAs, we actually have these amazing professionals. It's an amazing position that is domestic violence regional coordinators. These coordinators have a wealth of expertise in providing survivor services, survivor resources, comprehensive knowledge in all things survivor related to ensure that they are creating linkages in their regions, what's known as their SPAs, so that service providers, survivors, and other options like housing, counseling, mental health services are linked together so that a survivor has a comprehensive support network of resources. And these domestic violence resource coordinators, regional coordinators, are amazing assets to that team. And currently, under my supervision and Christina's supervision, we host monthly meetings. We discuss how things are progressing in their region, and we provide support, technical assistance, presentation, any support that the community is seeking to ensure that they expand their survivor services. These domestic violence regional coordinators help coordinate that effort.
I also want to mention that all of our efforts to align the domestic violence, human trafficking, and sexual assault system, along with the homelessness and housing system, has been possible through the work of the Domestic Violence and Homeless Services Coalition. It's a local organization that aims to ensure that there is communication and that we are actively trying to collaborate, work together to serve survivors in our community. I will say this group has been incredibly helpful because when we originally reached out to NASH to create the emergency transfer plan for our community, we were able to recruit several folks from that organization to be part of our local task force. Essentially, it is a body of community members, advocates from various regions of our county, wearing various hats and representing various organizations and various issues to help us craft a plan that they could stand behind and that they felt would serve our community. It was very important to us to include the voices of folks with lived experience, so we made sure that we had representation in that task force as well. All right, so now let's get into the emergency transfer plan. We created a really amazing, very comprehensive emergency transfer plan. And as we were getting ready to go in through the motions of putting it out into the world, COVID hit. So we found ourselves in a position where we had to pivot to address the needs of survivors in these new times. I don't know about you all, but this is the first pandemic I have been a part of. So we were able to keep some of our policies and some of the procedures that we had originally incorporated into the emergency transfer plan, but some of it did have to change just because of capacity during these times.
Okay, great. So we're going to go ahead and look at emergency transfer plans in our interim emergency transfer plan. Now, I'm just going to break down some of these questions and then distinguish the difference, if any. So
Jenny,
who does it cover?
Next slide, please. Sorry.
Thank you, Christina. Okay, so who does it cover? Our existing emergency transfer plan incorporated all programs, not just permanent housing. Not all, but some of those are bridge housing, crisis housing, permanent supportive housing, rapid rehousing, safe parking, transitional housing. And that is actually something that is carried over in the interim emergency transfer plan. Along with that, our existing ETP included survivors of domestic violence, sexual assault, and trafficking. That also is carried over in the interim ETP. And we did want to highlight that the definition of family is expanded in our existing ETP. So this is to include non-blood relatives and extended family members, as well as caregivers. And I do want to just highlight 2 notes from our actual definition of family. I'm going to just highlight 2 specific ones. The first one is members of the family do not need to be blood related, do not need to be related by blood, marriage, or in any other legal capacity. Sorry about that. And secondly, live-in aides are also considered family members. We wanted to do this to ensure that we extended that definition so that others who may be facing violence in a home are able to equally access the resource of an ETP. And that is also something that we were able to transfer over into our interim emergency transfer plan as well.
What does it look like? We had designed the emergency transfer plan to have it be centralized. The idea was to have an online portal where if survivors didn't feel comfortable going to their case managers or didn't know how to navigate accessing and securing a transfer, they could just go to our public website, find more information, and be able to request a transfer then and there. We had planned to have a set of what we call the transfer matchers, essentially folks that would have a bird's eye view of the entire county to be able to match folks more quickly. And then also we had planned to have a set of housing navigators for those participants that did not feel safe with their case managers. They could be placed in someone else's caseload, and that person would be in charge of assisting the transfer up until the survivor felt safe and was in a new unit. Unfortunately, a lot of that stuff is on hold at this time. Instead, we're asking agencies to first try to work with the survivor and secure a transfer that way. Agencies, I know there was some questions about costs. Agencies can use their existing funds to transfer folks if they need to. All they have to do is just let us know. And then another thing that we had to adjust, instead of having I want to say a team of transfer matchers, Betty will have to be taking over that centralized piece for the interim emergency transfer plan.
So we actually do now have the accessibility with the interim emergency transfer plan to allow survivors of any kind of experience with violence who may feel uncomfortable, uneasy, maybe even unsafe with their direct service provider, their case manager. We wanted to provide them an alternative of who to contact. So they actually also have a centralized email and phone number that would link them directly to myself. So if they have any questions, want to move forward with the process, they can actually access a direct person. Along with that, I'm also responsible for managing that information, making sure that it's logged and all of that is up to date. And then along with that, we also want to ensure that we're asking questions that builds a sense of rapport when speaking with us. If they're already hesitant to speak with a case manager, there is some anticipation that they may be uneasy about the process, unaware of what that process looks like. We do have some questions that we ask when trying to make that determination if an emergency transfer is what they're interested in and is a good fit for them. And it's really just opening up a call and connecting with the individual, asking about how they're doing, what's the circumstance that is going on, if they're interested in an emergency transfer plan, and then going the step further of just providing them information of what that means. Empowerment is a base model for building a survivor sense of self. So we want to use a lot of these grassroots intentions to build a survivor sense of information when they're going through a process. We also ask about their household, what that looks like. Where do they feel safe transferring to? Any location specifically, also considering safety location. So if there's an area that's a danger for them, whether it's where the person who does harm resides or family of that person, we want to also take that into consideration. And we do have a breakdown of about 11 questions that we go through with the participant, the survivor, to ensure that we are diligent with that transfer and we're being mindful of what their needs are when considering that transfer.
I do see a question about how these transfers are prioritized. And I will say our local approach to transfers is that we prioritize folks that have ADA needs first. I will say there's more units that are or can be accommodated to serve any folks that have any extra needs. And then we prioritize VAWA transfers, just because we do know that that is a very, or it can be incredibly dangerous, and we want to make sure that our neighbors are in a safe spot. And then after that, we do also include, you know, if anybody feels safe because there's gangs or anything of the sort, although I would assume that if someone does feel like their life is threatened, that would qualify for them to have a VAWA transfer. I will also mention that one of the other things that we wrote into the emergency transfer plan was lease bifurcation, essentially allowing a survivor to stay in a unit, and we would rehouse the partner who was causing harm. And we allowed our providers to give that survivor 12 months to find either the qualifying criteria to stay in that unit if that's what they wish, or to help them qualify for a different type of subsidy if that is the most appropriate route. That is something that we are able to keep. And just to give you all a quick example, as Larissa mentioned earlier, we're all trying to move our unsheltered neighbors indoors to reduce their COVID exposure, I'm going to say. And we did have a couple, and the qualifying partner who was part of, locally we call it Project Rimkey, it was the partner who was causing harm that qualified for the unit, but because he was causing harm, we were able to rehouse him in a different motel and keep the survivor there. And it was very important for us to make sure that the partner causing harm was rehoused. That way they had somewhere to go, they were somewhere safe, and they wouldn't have as easy and access to the survivor. Other things that we wrote into our emergency transfer plan is that we wanted to allow advocates, either they be DV, human trafficking, sexual assault advocates, therapists and the like, or anybody really that works with survivors, to request the transfers on the survivor's behalf. Of course, that will be with survivor's consent. We also wanted housing navigators to conduct assessments for those survivors that were in interim housing or transitional housing and did not have the appropriate assessment to connect them to permanent housing. And then one of our funnest additions was to allow survivors to leave a unit temporarily, just because we know sometimes a threat might not be or not feel like it'll be long lasting. So we wanted survivors to have the option to leave a unit for up to 150 days and then be able to return without any penalties or, you know, anything of the sort. But unfortunately, all of those things as of right now are put on hold.
Okay, and then we're also going to look at what documents are needed. So there is no requirement for documentation in order to begin a request for transfer. A verbal request is actually enough to begin that process, and that actually is also applicable to the interim emergency transfer plan. Release of information is needed though when speaking to third parties, and that as well has been applied to the interim emergency transfer plan. So the next question, and I do see that there are some questions that are popping up within the chat. We're going to go ahead and just move through this, but we'll definitely get responses for those questions that are coming up. Last question we're going to look at in terms of the ETP and the IETP is how are transfers being tracked? And I think I did mention this a little bit above in a previous response. Previously in the ETP, we were looking at centralized system of tracking through our transfer matchers, that bird's eye view that Christina mentioned. As of right now for the IETPs, what's been created is a website, and this has access to a portal where providers can input information, and that allows us to know when transfers are being requested. So it logs, dates that information, and then secondary support of tracking that information is my responsibility as well as a DV coordinator to make sure that we're tracking any transfers that are coming in, as well as any concerns, any support that's needed to ensure that we're moving them through the system and making sure that there's no delays in the needs that survivors have for an emergency transfer.
And I want to say that completes like the crash course of our emergency transfer plan.
Yes.
Okay, great. Thank you so much, Christina and Betty. So that concludes the content portion of our call today. I want to alert you to some COVID resources that we have here from on the Safe Housing Partnerships website, as well as NASH's website, and also the other consortium partners. So if survivor advocates or survivors want more information about COVID and any resources that they need, they can go to these websites. Next slide, please. Here's also our contact information if you have any follow-up questions, although I know there are many questions that were asked today, so we're going to try to go ahead and answer them right now. So Christina and Betty, since you just finished talking about the amazing LAHSA interim emergency transfer plan, there are a couple of questions that are for you. Thank you so much for answering the question about how to prioritize VAWA transfer requests in relation to other kinds of life or safety transfer requests. Some specific questions for you. Are the transfer matchers and navigators standalone positions, or are they additional duties that are attached to existing positions?
The transfer matcher would be a standalone position, and that person would not just oversee VAWA transfers, but they would oversee all transfers within the coordinated entry system. And in regards to the housing navigators, the plan for the housing navigators was for them to essentially work for a victim service provider, but their caseload would be made up of survivors navigating the coordinated entry system, and their caseloads would be much smaller, just so that they could take up extra survivors that needed that support when they requested transfers. So kind of a hybrid.
Great, thank you. Are the regional coordinators LAHSA employees? And if you're able to share, are their salaries funded by a grant?
They are not LAHSA employees. It was very important for us to ensure that the coordinators had strong roots in their community. And, you know, as you all heard, Los Angeles is very big. And I think working or having them work for a local agency gives them a little bit more street cred, which allows them to have more meaningful conversations and have a better impact than, you know, having the funder tell folks what to do. And I will say in our community, we're incredibly lucky. We have a lot of extra funds and their position is funded by our local Measure H. Essentially, it's a sales tax that our Los Angeles neighbors said that we needed in order to ensure that our homeless and houseless neighbors were getting the care that they needed. But I will say, I think that through the DV bonus, that might be a position that you all can apply for, but I could be wrong.
Thanks. And were there any other communities' policies that LAHSA had to consider in creating the emergency transfer policy?
I recall that we looked at Vermont, San Francisco, and Ohio, right? I think we took.
We did.
Okay, great.
We call them aspects, right? The aspects of the different policies.
Yes. So we essentially we gathered all of the task force members, gave them all the plans, and said, "What do you like best?" And that way, we were able to not completely recreate the wheel, but also implement some of the best practices and learn from other communities as well. So,
great. Okay, so there's a general question about VAWA. Could someone clarify a comment about invoking VAWA for someone who feels that their life is threatened by a gang? We've always understood that VAWA is specifically about DV intimate partner violence or sexual assault. So for example, our COC has not let us use an emergency transfer for a person in a shelter getting physically bullied by another person in the shelter where there's no sexual contact. So VAWA applies to survivors of domestic violence, sexual assault, dating violence, and stalking. You do not need an intimate partner relationship in order to have VAWA be covered. The way that those categories of violence are defined by VAWA includes situations where there is no prior intimate relationship. It also includes definitions of domestic violence under state and local laws. So for example, if in your jurisdiction, domestic violence includes situations where there's violence between roommates or violence between different family members, like parents and children, grandparents and grandchildren, siblings, then all of that violence would be covered by VAWA. And actually there was one situation where, because this specific question asked about gangs, there was a situation where a survivor had an ex-boyfriend who was very abusive, who was also involved in a gang. And because of that, he had his gang members harass, bother the survivor. And that was considered to be part of VAWA because again, the violence arose because of the relationship and the violence of the ex-boyfriend against the survivor. So all of these questions about VAWA's coverage can be very fact specific, but know that we are thinking a little more expansively than just intimate partner violence. Okay.
And Carlo, I would just add, this is Kate, that there are transfers outside of VAWA. So there are emergency transfers under the Violence Against Women Act, but there are other transfers that your housing authority may have. For example, due to violence unrelated to VAWA, due to a reasonable accommodation, overcrowding, conditions in the home. So just to be sort of understand that it's in a full context of transfers.
Right, thanks for that, Kate. Yeah, so there are other kinds of transfers that are possible, both emergency and what's called administrative or non-emergency transfers for a whole host of other reasons as well. So COC funds allow for one-time moving expenses for supportive housing program. From my understanding, we are unable to provide moving funds a second time if the family needs to transfer. Does anyone on the panel want to address that?
I'll take it, Carlo. I actually responded in the chat to this too. So there is flexibility in terms of emergency transfer. So for example, there is no set number of transfers that can be requested if there is a safety need by a survivor. So there is flexibility in terms of finding funding to support rental assistance or whatever may be needed as part of that transfer. And that's a conversation that needs to be had within the COC. It's really challenging, or the balance of state, it's challenging for providers to navigate, or programs to navigate, or organizations to navigate that individually. So that is something that needs to be implemented and discussed as part of the parameters of the emergency transfer policy and the operability of it. That is a common sort of question that we get. A lot of the questions we get have to do with programs or organizations not having immediate access to funding to make transfers happen. And as Christina mentioned, LAHSA has worked really hard to ensure that programs know that they can use the funding that they have, and that if there's any issue in terms of utilizing that funding, to contact LAHSA directly to figure it out, so that the process is not stymied.
Great, thank you, Larsa. So we have 3 minutes left, and I did not want to forget to mention that we actually have a survey, next slide please, that we would love for you all to complete if you have a few minutes. It's a survey about what survivors and their advocates need during this time at COVID. It'll only just take you a few minutes. If you could complete that, that would be really, really helpful to us. And since we have 2 minutes left, I'll just, there were a couple of questions about moratoriums. And I think because there are a lot of questions that folks asked, either we answered them or they're still outstanding, maybe we'll actually put together a Q&A that will circulate to folks that we can, so that folks can have a response to their questions. But Kate, just to wrap up, can you provide us some information about whether the federal moratorium, the federal eviction moratorium, is that based on domestic violence or sexual violence, or just non-payment of rent?
The federal eviction moratorium applies only to non-payment cases. So, and that's in effect from March 27th to July 25th, 2020. So it does not protect against other eviction cases. However, the prohibition on evicting survivors under the Violence Against Women Act remains intact. So they cannot do it. They're just not necessarily subject to the moratorium. The other thing you have to consider is, does your state or local jurisdiction have an eviction moratorium? And what that may look like varies state by state and locality, but it's oftentimes that the courts are simply not hearing those eviction cases, or not allowing eviction orders where someone is physically removed from the home to take place. So you do need to be aware of what is happening at the local and state level. And just to remind PHAs and housing choice voucher property owners that even though the federal eviction moratorium is with respect to non-payment, it doesn't do anything with respect to saying that you're now allowed to evict a survivor. It does say, not very clearly, but this is the intent, that they could proceed with perpetrator evictions. And so if there isn't a moratorium at the state or local level, that would be an option for a survivor.
Thanks so much, Kate. And just as a reminder, we did do a special series call on the federal eviction moratorium, and there was a very quick overview of state and local moratoria a few weeks ago, so we can recirculate that webinar recording and the resources as part of this webinar as well. So we are at time, so thank you everyone for joining us today. The recording as well as the PowerPoint will be circulated very soon, and please stay safe and take care. Thanks so much.